Hey friends, welcome back to the channel. In this video, I interviewed one of the respiratory medicine specialist consultants at my hospital called Dr. Thomas, and he shared 10 things that we can do right now to help combat the spread of the coronavirus that's causing COVID-19 that's taking over the world, basically. Everything is going to be linked in timestamps in the video description and in a pinned comment, so you can jump around the video if you feel like it, and I will start with a very quick summary of everything that we discussed. So if you don't have too much time to watch this video, at least you'll get like the most bang for your buck out of it. So firstly, we talked about the importance of not panicking and preparedness being the key rather than panicking. Secondly, we should all be following the instructions from high command. So in the UK, we should be following the advice of Public Health England and the government, and this applies to whichever country that you're in. Thirdly, we talked a lot about social distancing and what that actually looks like and why it's so important. And then we talked about the importance of avoiding physical contact with elderly relatives because they are by far more vulnerable than young, fit, healthy people. Point number 5 was conditions for self-isolation, and the point we made was that basically this situation is so rapidly evolving that you should always consult the guidance from above whenever you're watching this video. But at the moment, the advice is that if you're symptomatic, then you should quarantine, self-isolate yourself for 14 days, because that's how long, based on the research, we think the disease is infectious for. Point number 6 is really important to keep up your physical health, mental health and everything, exercising during the pandemic, just not doing it in crowds or with other people. Point number 7 is the importance of washing our hands, especially when we're coming into and out of the house, when we've just been to work, when we're coming back home from work, after we've handled anything that has contact with the outside world. Point number 8, please stop smoking. It's really, really important. Point number 9, avoid comparing what's happening in your own country, in our country, in the UK, wherever you're watching this, with what's happening in other countries. The system, the epidemiology, the sort of healthcare resources in different countries are markedly different. And so the advice from country to country is going to differ. Yeah, sure, maybe everyone in Hong Kong is wearing face masks, but the advice for us in the UK is to not wear face masks, for example. And point number 10, we addressed this classic issue of kind of young people not taking this seriously and thinking, you know, well, I'm young and I'm fit and healthy and I don't care if I get it, I'm going to be asymptomatic. But it's not about you if you're young. I'm pretty fit and healthy, but I'm still social distancing, I'm still isolating myself because it's not about me, it's about the wider population, and I do not want to be responsible for people's death because I've passed the virus on to someone else who's more susceptible to it. So that was a quick summary of the things that we talked about, and now for the rest of the video, it'll be Dr. Thomas sharing his professional expert level advice as a respiratory medicine consultant, as a specialist, about what we can be doing, the 10 things we could be doing to help reduce the spread of the pandemic and basically how to respond well to it. Here we go.
Panic is one of the things that we shouldn't do because it doesn't help anybody. There's panic that spreads more widely than the virus, which can be very, very harmful. So it's important that we try and sort of wind that down and sort of ramp up our preparedness in the right sort of way.
Okay, so prepared, not panicking.
Prepared, not panicking, definitely. You know, we're fighting a war, but we're doing it sensibly. We need each one of you to be able to get this right. You have to keep up because the instructions change on a day-to-day basis because of this process of trying to contain the virus. So if you were to think about that analogy of war, if we don't follow instructions from high command, who have a lot more information than we do, things can go completely wrong. To make it simple, the Department of Health tells you exactly what you should do as a member of public at any given time. Follow those instructions.
You know, where we are right now, today is the 21st of March. What would you say are the most important things that we as the general public should be doing?
Social distancing is really important. Driving through Cambridge, the number of cars that were coming into town, that worries me. You know, the fact that people are not listening to the suggestion that we should sort of be winding down on social activity. The reason I'm saying that is because the virus spreads from one individual to another. If you are in close contact of less than a meter, you're more likely to get the virus spread to yourselves. If we slow the spread of the virus down, what that then allows us to do is to be able to deal with the people who are really sick in a paced manner. You know, so if we all get the virus quickly together, the number of people who die goes up. You're actually saving lives by following the simple instruction of social isolation and distancing. So this is really important. At this stage of the epidemic, where we are today, you need to protect your elderly relatives. You need to protect those who are vulnerable. And the way to find out who those people are is to go to the NHS England website, and they actually have a list of people. The general list is people with chronic respiratory disease, people with chronic heart disease, diabetics, people who are vulnerable because of recent chemotherapy for cancers, people who are immunosuppressed because of immune conditions.